Did you know that nearly 1 in 4 adults experience joint pain? Have you ever wondered why your joints ache even when you think you're doing everything right? What if I told you that just a few simple habits could transform your joint health and keep you pain-free for life? In this video, we're diving into the most powerful daily habits that protect your joints, prevent arthritis, and keep you moving smoothly as you age. Stick around, because these tips might be the game changer you've been looking for. Maintaining a healthy weight is one of the most crucial factors in preserving your joint health and preventing chronic pain. Excess weight puts additional strain on your joints, particularly those in your knees, hips, and lower back, which bear the brunt of your body's load. But why exactly is maintaining a healthy weight so important for your joints, and how does it impact them on a deeper level? When you carry extra weight, your joints, especially those in the lower body, have to work much harder. For every pound of extra weight, there's an additional 4 pounds of pressure on your knees. Imagine the stress this adds up to over time. This constant pressure wears down the cartilage that cushions your joints, leading to conditions like osteoarthritis, a degenerative joint disease characterized by the breakdown of joint cartilage and underlying bone. Cartilage is like a shock absorber for your joints. It helps bones glide smoothly against each other during movement. However, when you're overweight, the increased pressure on your joints accelerates cartilage wear and tear. Once the cartilage is worn down, bones begin to rub against each other, causing pain, stiffness, and inflammation. This process is irreversible and can significantly reduce your quality of life by limiting your mobility and independence. But it's not just about the mechanical stress. Excess body fat, especially visceral fat that surrounds your organs, produces inflammatory chemicals called cytokines. These cytokines can cause chronic inflammation throughout your body, including in your joints. Inflammation not only accelerates cartilage breakdown, but also contributes to the pain and swelling associated with conditions like arthritis. This means that being overweight not only increases the physical load on your joints, but also triggers a biochemical response that further damages them. Achieving and maintaining a healthy weight can significantly reduce your risk of joint problems. Studies have shown that even modest weight loss can alleviate pressure on the joints and reduce the symptoms of osteoarthritis. For instance, losing just 10% of your body weight can lead to a significant reduction in joint pain and improve joint function. This is particularly important as we age, as the natural wear and tear on our joints becomes more pronounced. It's also worth noting that maintaining a healthy weight doesn't just benefit your joints. It improves your overall health, reducing the risk of conditions like heart disease, diabetes, and high blood pressure. But from a joint health perspective, the benefits are clear. Less weight means less pressure, less wear and tear, and a lower risk of developing debilitating joint conditions. In conclusion, maintaining a healthy weight is essential for protecting your joints from the damaging effects of excess pressure and inflammation. By adopting a balanced diet, engaging in regular physical activity, and making sustainable lifestyle changes, you can keep your joints healthy and pain-free for years to come. Your joints are designed to support you, so give them the best chance to do their job by keeping your weight in check. Moderate physical activity is one of the best things you can do for your joints. While it might seem counterintuitive, regular movement is essential for keeping your joints healthy and preventing conditions like arthritis and chronic pain. But what exactly is moderate physical activity, and why is it so important for your joints? Joints are designed to move. They're where two bones meet and allow for flexibility, mobility, and support. When you engage in moderate physical activity, you help maintain the strength and flexibility of the muscles that support these joints. Strong muscles act like shock absorbers, reducing the stress placed directly on the joints themselves. This helps prevent the wear and tear that can lead to degenerative joint diseases like osteoarthritis. But the benefits of moderate physical activity go beyond just muscle strength. Movement helps circulate synovial fluid, a lubricating liquid that nourishes the cartilage and reduces friction between the bones. Think of synovial fluid as the oil in an engine. It keeps everything running smoothly. When you're active, your body produces more of this fluid, which helps keep your joints well lubricated and functioning properly. Without regular movement, this fluid can become stagnant, leading to stiffness and increased risk of joint injury. Moderate physical activity also helps control inflammation in the body. While intense, high-impact activities can sometimes increase inflammation, moderate exercise has the opposite effect. It helps regulate the production of cytokines, which are inflammatory chemicals that can damage joints when present in excess. By keeping inflammation in check, you reduce the risk of joint pain and stiffness. Another critical benefit of moderate exercise is weight management. As discussed, excess weight puts a lot of stress on your joints, particularly in the knees, hips, and lower back. Regular moderate exercise helps you maintain a healthy weight, thereby reducing the load on your joints and lowering your risk of developing conditions like osteoarthritis. So what counts as moderate physical activity? Activities like brisk walking, swimming, cycling, and yoga are all excellent examples. The key is to find something you enjoy and can sustain over time. You don't need to run marathons or lift heavy weights to protect your joints. In fact, doing so without proper preparation can do more harm than good. The goal is to engage in activities that get your heart rate up and keep your body moving without putting too much stress on your joints. It's also important to note that consistency is key. Aim for at least 150 minutes of moderate physical activity per week, as recommended by health experts. This could be as simple as a 30-minute walk 5 times a week. Breaking it down into manageable chunks makes it easier to stick with, and your joints will thank you for it. In conclusion, moderate physical activity is a cornerstone of joint health. It strengthens the muscles that support your joints, keeps them lubricated, reduces inflammation, and helps manage your weight, all of which are crucial for preventing joint problems and maintaining mobility as you age. By incorporating regular, moderate exercise into your routine, you can keep your joints healthy and enjoy a more active, pain-free life. Maintaining proper posture is more important for your joint health than you might think. The way you sit, stand, and move throughout the day can have a significant impact on your joints, particularly those in your spine, hips, knees, and shoulders. But what exactly is proper posture, and how does it benefit your joints? Proper posture means aligning your body in a way that minimizes strain on your muscles, ligaments, and joints. When your body is in proper alignment, your joints are positioned correctly, and the stress on them is distributed evenly. This helps to prevent the wear and tear that can lead to joint pain and long-term issues like arthritis. When you slouch or sit in a hunched position, your spine is forced into an unnatural curve. This puts extra pressure on the discs between your vertebrae and the joints in your spine. Over time, this can lead to degenerative changes, such as herniated discs or osteoarthritis. Poor posture also strains the muscles and ligaments that support your spine, leading to muscle fatigue and pain. But it's not just your spine that's affected. Poor posture can also impact other joints in your body. For example, if you constantly tilt your head forward while looking at a screen, you're putting extra stress on the joints in your neck and shoulders. This can lead to conditions like tech neck, where the muscles in your neck become tight and painful, and the joints in your cervical spine start to wear out prematurely. Similarly, poor posture while sitting can affect your hips and knees. If you cross your legs or sit with your knees higher than your hips, you're putting extra strain on the joints in these areas. Over time, this can lead to joint pain and stiffness, particularly if you're sitting in these positions for long periods. On the other hand, maintaining proper posture helps to keep your joints in their natural position, where they can function most efficiently. When your joints are properly aligned, the muscles around them don't have to work as hard to support you, which reduces the risk of muscle fatigue and joint strain. Proper posture also promotes better circulation and breathing, both of which are important for overall joint health. So how can you improve your posture? Start by being mindful of how you sit and stand throughout the day. When sitting, keep your back straight and your feet flat on the floor. Your knees should be at a right angle, with your hips slightly higher than your knees. When standing, distribute your weight evenly on both feet and avoid locking your knees. Keep your shoulders back and your head aligned with your spine. In conclusion, proper posture is a simple yet powerful way to protect your joints from unnecessary strain and wear. By making small adjustments to the way you sit, stand, and move, you can help ensure that your joints stay healthy and pain-free for years to come. Using proper lifting technique is essential for protecting your joints, particularly those in your back, knees, and shoulders. Many people don't realize the impact that improper lifting can have on their joints until they experience pain or injury. But with the right approach, you can significantly reduce the risk of joint damage and keep your body safe and strong. When you lift heavy objects incorrectly, such as bending at the waist instead of at the knees, you place tremendous stress on your lower back. This can lead to injuries like herniated discs or chronic lower back pain. Your spine is designed to support your body's weight, but when you lift improperly, the load isn't evenly distributed across your spine and joints. Instead, certain areas are forced to bear more weight than they should, increasing the risk of injury. The key to proper lifting technique is to use your legs, not your back, to lift. This means bending at the knees and hips, keeping your back straight, and holding the object close to your body. By doing this, you engage the large muscles in your legs, which are better equipped to handle heavy loads. Your spine stays in a neutral position, reducing the strain on your vertebrae and the joints in your lower back. It's also important to avoid twisting your body while lifting. Twisting combined with lifting can be particularly harmful because it puts uneven pressure on the spine and can lead to joint injuries or muscle strains. Instead, turn your whole body by moving your feet, keeping your torso aligned with your hips. Proper lifting technique doesn't just protect your back, it also reduces the strain on your knees and shoulders. When you lift with bent knees, you're less likely to overextend your knee joints or put undue pressure on them. Similarly, keeping the load close to your body and avoiding sudden, jerky movements helps protect your shoulder joints from strain. In conclusion, using proper lifting techniques is crucial for maintaining joint health and preventing injuries. By bending at the knees, keeping your back straight, and avoiding twisting motions, you can lift heavy objects safely and reduce the risk of long-term damage to your joints. Incorporating these habits into your daily routine will help keep your joints strong and pain-free, allowing you to stay active and healthy for years to come. Wearing comfortable and supportive footwear is more than just a matter of comfort. It's crucial for the health of your joints, especially those in your feet, knees, hips, and lower back. The shoes you wear every day can significantly impact your posture, alignment, and the distribution of pressure throughout your body, all of which play a vital role in maintaining healthy joints. When you wear shoes that don't provide adequate support, your feet are forced into unnatural positions that can disrupt your body's natural alignment. For example, high heels shift your weight forward, placing excessive pressure on the balls of your feet and altering the alignment of your knees, hips, and spine. Over time, this misalignment can lead to joint pain and conditions such as plantar fasciitis, knee osteoarthritis, and lower back pain. Supportive shoes help maintain proper foot alignment and distribute your body weight evenly across your feet. This even distribution reduces the strain on your joints and helps prevent the development of joint-related issues. Good arch support is particularly important, as it helps to stabilize your feet and prevent overpronation or supination, common foot problems that can lead to joint pain and injury. Shoes with proper cushioning also absorb shock as you walk, reducing the impact on your knees and hips. It's not just about the shoes you wear for exercise. Your everyday footwear is equally important. If you spend long hours standing or walking, investing in quality, supportive shoes can make a significant difference in how your joints feel at the end of the day. Shoes that fit well and offer the right amount of support can help prevent joint fatigue, pain, and long-term damage. When choosing footwear, look for shoes with a firm yet cushioned sole, adequate arch support, and a design that allows your feet to move naturally. Avoid shoes that are too tight or too loose, as they can cause blisters, calluses, and discomfort, leading to changes in how you walk and, ultimately, how your joints bear weight. In conclusion, comfortable and supportive footwear is essential for maintaining joint health. By choosing the right shoes, you can protect your feet, knees, hips, and back from unnecessary strain and prevent joint-related problems before they start. Prioritizing proper footwear is a simple yet effective way to support your joint health and keep you moving comfortably every day. Taking regular breaks and changing your position throughout the day are simple yet powerful habits that can make a big difference in the health of your joints. Whether you're sitting at a desk, standing for long periods, or engaging in repetitive tasks, staying in one position for too long can lead to stiffness, discomfort, and even long-term joint problems. But how exactly do these habits benefit your joints? When you remain in one position for an extended period, certain muscles and joints are under constant stress while others may not be used at all. This imbalance can cause muscle fatigue, poor circulation, and joint stiffness. For example, sitting for hours on end can lead to tightness in the hip flexors, pressure on the lower back, and reduced mobility in the knees. Over time, these issues can contribute to chronic joint pain and even conditions like osteoarthritis. Regular breaks give your muscles and joints a chance to rest and recover from the strain of staying in one position. Even short breaks of just a few minutes can help relieve pressure on your joints and prevent stiffness. During these breaks, it's important to move around, stretch, and change your position. This not only improves circulation but also helps to redistribute the stress on your joints, reducing the risk of overuse injuries. Changing your position frequently throughout the day is another key strategy for joint health. If you're sitting, try to stand up and move around every 30 to 60 minutes. If you're standing, shift your weight from one foot to the other, or take a moment to sit down and rest. By regularly changing your position, you prevent the buildup of pressure on specific joints and reduce the likelihood of developing joint pain. For those who work at a desk, consider using an adjustable chair and desk setup that allows you to alternate between sitting and standing. This can help you maintain a more neutral posture and reduce the strain on your back, hips, and knees. Additionally, incorporating small stretches and movements into your routine can keep your joints flexible and prevent stiffness. In conclusion, regular breaks and changing your position are essential habits for maintaining joint health. By giving your joints a break from constant pressure and keeping them moving throughout the day, you can prevent stiffness, reduce the risk of injury, and support long-term joint health. It's a simple practice that can have a profound impact on how your joints feel, both now and in the future. Maintaining flexibility through regular stretching is a key component of joint health. Flexibility refers to the ability of your muscles and joints to move through their full range of motion. When your joints are flexible, they're less likely to become stiff and more likely to function properly, reducing the risk of injury and chronic pain. But how exactly does stretching benefit your joints, and why is it so important? As we age, our muscles and tendons naturally become tighter, and our joints lose some of their flexibility. This process can lead to reduced mobility, making everyday activities more challenging and increasing the risk of falls and injuries. Stretching helps counteract this natural decline in flexibility by keeping your muscles and joints supple and responsive. Regular stretching exercises elongate your muscles and improve the elasticity of your tendons, allowing your joints to move more freely. When you stretch, you're not only improving your flexibility, but also enhancing circulation to your muscles and joints. Increased blood flow brings oxygen and essential nutrients to your joint tissues, promoting healing and reducing inflammation. This can be particularly beneficial for those with conditions like arthritis, where inflammation is a significant source of pain and stiffness. Stretching also helps to relieve muscle tension and prevent imbalances that can lead to joint strain. For example, tight hamstrings can pull on the lower back and contribute to poor posture, which in turn puts stress on your spinal joints. By incorporating stretching into your daily routine, you can address these muscle imbalances and maintain proper alignment, which is crucial for joint health. It's important to approach stretching with care. Stretching should be gentle and controlled, without forcing your body into uncomfortable positions. Focus on the major muscle groups that support your joints, such as the hamstrings, quadriceps, hip flexors, and calves. Hold each stretch for 20-30 seconds, and remember to breathe deeply, as this helps relax your muscles and deepen the stretch. In addition to static stretching, which involves holding a stretch for a period of time, dynamic stretching can also be beneficial. Dynamic stretching involves moving your joints through their full range of motion, preparing your muscles and joints for physical activity. This type of stretching is particularly useful before exercise, as it warms up your joints and reduces the risk of injury. In conclusion, maintaining flexibility through regular stretching is essential for joint health. By keeping your muscles and joints flexible, you can prevent stiffness, reduce the risk of injury, and ensure that your joints remain functional and pain-free as you age. Incorporating stretching into your daily routine is a simple yet effective way to support your joint health and overall well-being. Quitting harmful habits like smoking and excessive alcohol consumption is crucial for maintaining healthy joints. While many people are aware of the negative impact these habits have on overall health, their specific effects on joint health are often overlooked. However, the truth is that smoking and alcohol can significantly contribute to joint pain, inflammation, and long-term damage. Smoking is particularly harmful to your joints because it affects the body's ability to heal and regenerate tissue. Nicotine, along with other toxic chemicals in cigarettes, restricts blood flow by constricting blood vessels. This reduced circulation means that your joints receive less oxygen and fewer nutrients, which are essential for repairing cartilage and maintaining healthy tissues. Over time, this lack of proper nourishment can lead to the degeneration of joint cartilage, increasing the risk of osteoarthritis, a condition where the protective cartilage in your joints wears down, causing pain and stiffness. Additionally, smoking promotes inflammation throughout the body. Chronic inflammation is a key factor in the development and progression of joint diseases, such as rheumatoid arthritis. The toxins in tobacco can trigger and exacerbate inflammatory responses in the joints, leading to increased pain, swelling, and reduced mobility. Excessive alcohol consumption is another habit that can negatively impact your joints. Alcohol can disrupt the balance of nutrients in your body, particularly those that are vital for bone and joint health, like calcium and vitamin D. Regular heavy drinking can lead to weaker bones and joints, increasing the risk of fractures and joint injuries. Alcohol also contributes to inflammation and can worsen the symptoms of conditions like arthritis. Moreover, alcohol has a direct impact on weight gain, which in turn places additional stress on your joints, particularly in the lower body. Carrying excess weight exacerbates joint problems by increasing the pressure on your knees, hips, and lower back, leading to more rapid wear and tear. Quitting smoking and moderating alcohol consumption are essential steps in protecting your joint health. By giving up these harmful habits, you can reduce inflammation, improve circulation, and enhance your body's ability to maintain healthy joints. In doing so, you'll not only feel better in the short term, but also protect your joints from long-term damage, ensuring you stay active and pain-free for years to come. Getting regular rest and quality sleep is essential for maintaining healthy joints. While exercise and activity are important for joint health, the time you spend resting and sleeping is equally crucial. During these periods, your body undergoes critical repair processes that help reduce inflammation, relieve stress on your joints, and promote overall joint function. When you sleep, your body enters a state of repair and regeneration. This is when your body works to heal the micro-damages that occur in your joints and muscles throughout the day. Sleep allows your body to produce more collagen, a key protein that helps maintain the strength and flexibility of your cartilage, tendons, and ligaments. Adequate sleep ensures that your joints are well supported and can recover from daily wear and tear, reducing the risk of joint pain and injury. In addition to physical repair, sleep also plays a vital role in managing inflammation. Lack of sleep has been shown to increase the levels of inflammatory markers in the body, which can exacerbate conditions like arthritis and lead to more joint pain and stiffness. By getting enough sleep, you help regulate your body's inflammatory response, keeping inflammation in check and protecting your joints from unnecessary stress. Rest during the day is also important, especially if you engage in activities that put stress on your joints. Taking regular breaks allows your joints to recover and prevents overuse injuries. Whether you're working at a desk, exercising, or standing for long periods, giving your joints a chance to rest can help reduce fatigue and prevent chronic pain. Moreover, the quality of your sleep matters just as much as the quantity. Poor sleep posture, such as sleeping in a position that puts strain on your back or neck, can lead to joint pain. Investing in a good mattress and pillows that support proper alignment can make a big difference in how your joints feel in the morning. It's also important to develop a consistent sleep routine. Going to bed and waking up at the same time each day helps regulate your body's internal clock, making it easier to fall asleep and stay asleep. A consistent sleep schedule not only improves your overall sleep quality, but also ensures that your joints get the regular rest they need to stay healthy. In conclusion, regular rest and quality sleep are essential components of joint health. By prioritizing sleep and taking breaks during the day, you give your body the time it needs to repair and protect your joints, helping you stay active, pain-free, and healthy for years to come. Controlling inflammation and pain is crucial for maintaining healthy joints and preventing long-term damage. Inflammation is a natural response by your body's immune system to injury or infection. But when it becomes chronic, it can lead to joint damage and conditions like arthritis. Understanding how to manage inflammation and pain effectively can help you protect your joints and maintain an active, healthy lifestyle. Inflammation in the joints is often the result of wear and tear, autoimmune reactions, or injuries. When your body detects damage, it sends white blood cells to the affected area to fight off infection and start the healing process. This response, while necessary, can cause swelling, heat, and pain in the joints. In the short term, inflammation can be beneficial, helping your body to heal. However, when inflammation becomes chronic, it can lead to the breakdown of joint tissues, causing pain and stiffness that can interfere with daily activities. Managing inflammation begins with identifying and addressing its root causes. For many people, lifestyle factors such as diet, stress, and lack of exercise play a significant role in chronic inflammation. Eating a diet rich in anti-inflammatory foods, such as fruits, vegetables, whole grains, and omega-3 fatty acids, can help reduce inflammation. Conversely, processed foods, sugary snacks, and red meat can exacerbate inflammatory processes. Regular physical activity is also important for managing inflammation and pain. Exercise helps to keep your joints flexible, strengthen the muscles that support them, and reduce overall inflammation in the body. However, it's important to strike a balance. Overexertion can lead to joint damage, while too little activity can result in stiffness and increased pain. It's also important to pay attention to your body's signals. If you experience persistent joint pain or notice signs of inflammation, such as redness, warmth, or swelling, it's essential to consult a healthcare professional. Early intervention can help prevent further joint damage and improve your quality of life. In conclusion, managing inflammation and pain is key to preserving joint health. By adopting a healthy lifestyle, incorporating regular exercise, and seeking appropriate medical treatment when necessary, you can reduce inflammation, alleviate pain, and protect your joints from long-term damage. Taking proactive steps to control inflammation will help you maintain mobility and enjoy a more active, pain-free life. In conclusion, maintaining healthy joints is a lifelong commitment that involves more than just avoiding bad habits. It's about embracing positive ones that support and protect your joints every day. By focusing on maintaining a healthy weight, engaging in moderate physical activity, practicing proper posture and lifting techniques, wearing comfortable and supportive footwear, taking regular breaks, and ensuring you get enough rest and sleep, you can significantly reduce your risk of joint pain and long-term damage. Managing inflammation and pain is also key to keeping your joints in top condition. By staying mindful of your body's signals and making informed choices, you can prevent the chronic issues that often lead to more severe joint problems down the road. If you haven't already, make sure to check out my previous video, 10 Joint Killers You Need to Avoid for Healthier, Pain-Free Joints. It dives deep into the habits that could be secretly harming your joints and offers insights on how to avoid them. Understanding what not to do is just as important as knowing what to do. And this video is a perfect complement to everything we've discussed today. And don't forget to subscribe and hit the bell icon, because in the next video, I'll be talking about the vitamins and minerals that are essential for joint health. We'll explore how you can get these nutrients through your diet and, if needed, through supplements. This upcoming video will provide you with the information you need to further protect your joints and ensure they stay strong and flexible as you age. Thank you for watching, and I look forward to seeing you in the next video, where we'll continue our journey toward better joint health together. Stay active, stay healthy, and keep taking care of those joints. See you in the next video.